Pearl, I am so happy to be with you today to talk about a disease that's near and dear to both of our hearts, which is vitiligo, and something we've both dedicated our careers to. The concept of hope and providing patients with hope and optimism, I think, is something that we must continue to educate our colleagues in dermatology and the broader medical world about. How do you view hope in vitiligo?
Seemal, first and foremost, it is truly my honor and pleasure to partner with you to talk about hope in vitiligo. This is a concept that I am truly passionate about. For every patient who comes to the Vitiligo and Pigmentation Institute of Southern California, it's so common for individuals to come in with angst. They are terrified of the unknown. And our vision, mission, and mantra is to have that patient, to have the transformation occur from anxiety, angst to hope. You come in with anxiety and angst, but every patient has to leave with hope because hope is an essential part of the paradigm of treating this therapeutically challenging condition. We can't do it without.
And I really could not have said it better. And I love the fact that you tied hope into therapeutic paradigm because optimism is part of the therapy, is part of what we do. It's part of our visit. And now in 2026, with us being on the cusp of so many new treatments, hope is something absolutely, even if you're not a vitiligo expert, you should be able to give to your patient. I remember when we had the FDA approval for ruxolitinib, how many people came into our practices asking about new options because they heard about it online or on social media or a TV commercial. So now more than ever, this concept of prescribing hope, prescribing something that's not a traditional therapy, yet it is a therapy. Wouldn't you say it's part of our armamentarium?
Oh, absolutely. And I think it is the ultimate tragedy for any patient in 2026 to see a physician and be told that Mrs. Jones, Mr. Smith, there is no treatment for vitiligo because we are so beyond that in what we have the capabilities and science in being able to offer our patients. This is the dawn of a totally new era and paradigm in the management of vitiligo.
And I think the call to action for anyone watching us today, if you leave with nothing, leave with knowing that the next time you see a vitiligo patient, simply telling them there is no cure and here's a topical steroid is not adequate in terms of treatment. You may not have to be a vitiligo expert, but please do not let that patient leave your office without knowing there are experts out there, number one. There are treatments being studied, number two. There are clinical trials that they can participate in, number three. And most importantly, there is hope on the horizon. I just think that's so important because I still see people coming in that said, oh, my other doctor just gave me this steroid cream, told me to use it for a few weeks. And if it doesn't work, there's nothing they can do.
I couldn't agree with you more, Samal. This is, having worked in this area now for 45 plus years and having been a part of the evolution, and I'm also going to say the revolution, okay?
Right. And you've seen it.
Yeah, it really brings me so much joy to see where we are in the amazing paradigms, the paradigms and the transformations and these pivotal moments in what we can offer our patients with vitiligo. And back to a comment that you made, certainly if you don't want to treat vitiligo, if it's not your wheelhouse, just tell that patient. There's
Right.
so many new patients and
Absolutely.
give them that referral. I'll help you find an expert. or go to the Global Vitiligo Foundation. They have a list of experts in the United States and outside the United States.
Thank you for saying that because there is the opportunity to help empower our patients. And if there are any patients or the public who happen to listen to this today, ask those questions. Is there someone who might be able to help me further? Is there a center or a clinical trial I can get involved in? What's new? What's coming? We want our patients to be as educated and empowered as possible. And Pearl, as we kind of wrap this up, is there one thing that you're most hopeful about in 2026, or is it just that there's so much coming that you and I are both excited?
Well, I'm so excited, Seemal, about so many things. You know,
Right.
I
Right.
think that if I look at where we are in 2026, I think I have to look at it from a perspective of what has transpired over the last 2 to 3 years. What do I mean by that? You know, the topical JAK inhibitors, uh, ruxolitinib, Opzelura has made such a profound difference in how we manage our patients. It's accessible. It works in patients who have less than 10% involvement. So I think that if we look at where we were at the time of the approval and where we are now, we've made this having access to this medication has really, it's made a substantial impact. And the other great thing is, you know, one of the issues that we deal with in managing patients is patients think that if it doesn't happen in 2 weeks or 3 weeks, it's not going to happen, or it's going to plateau. So what we know is this drug really works and it doesn't plateau. If you take a patient out to 2 years, they have the capacity to continue to see enhanced repigmentation with continued use. So I continue to be excited about that. And I continue to be excited about the new oral JAKs that will come into the marketplace that will facilitate our
Absolutely.
abilities to achieve stabilization as well as repigmentation. So I'm
Pearl,
excited.
I, you always leave me speechless, so I have nothing more to say except to say that talking to you gives me hope. And I hope that our listeners today know that there is a whole world of vitiligo that we have yet to discover, and there's a lot more on the horizon looking forward. So thank you, Pearl, for joining me, and I look forward to seeing you again soon.
My honor, Seemal.